Okay, our next company is Visionflex Group Limited. The ASX code for Visionflex is VFX, and it has a market cap of approximately 13 million. Visionflex has a comprehensive range of cutting-edge clinical telehealth devices, medical equipment, and software solutions. Presenting today is Chief Executive Officer Josh Mundy. Josh, welcome, and please take it away.
Thank you, Manny, and great to be here on the program today. You've done a good job of introducing the company, so I might get you just to go straight to slide 3 for me, please. So I thought I'd touch on today just some of the highlights of the Visionflex Group. We've had quite a big 12 months in a merger with First Group in mid-2022. So we've brought in a highly experienced team that I'm lucky to lead, joining the company as CEO 12 months ago. And also a brand new board as part of that merger. And that team's got a great history in healthcare, in financial services, and right across ASX companies. So evident in some of the results to date, many with the revenue of the group up 30% in the first half of this year in comparison to the prior first half of FY23. And also impressively in some of the costs of the company, we've been able to dramatically reduce the losses of the company, an 84% reduction, in fact, of after-tax losses, down to $500,000 in the first half of this financial year against $3.3 million in the first half. So really excited with what we've done through a restructure. And now our eyes are solely focused on Visionflex after divesting and strategically exiting some of the First Group businesses. So Visionflex itself is in the virtual healthcare space, as you've mentioned. Our team based out of Warriewood on the Northern Beaches here in Sydney, founded in 2014 by medical engineers and founded to create essentially virtual care, allowing practitioners, doctors, nurses, specialists to develop and deliver virtual care, just like they would in a hospital or in a physical location, being able to treat patients, diagnose patients, and examine patients with our technology, both in hardware and software. And in a post-pandemic world, those products are in demand. Our clients are underpinned by government contracts in state health, in federal health, as well as large enterprise customers in aged care and healthcare. And really what they're looking to do is shift to virtual in order to provide a much more cost-effective and timely delivery of healthcare in Australia and overseas. So a strong sales pipeline for Visionflex. We're not just an Australian company. We have generated $1 million in revenue in over 7 countries overseas. And here in Australia, we're well established in key verticals of aged care, hospitals, primary care, and doing some great work in the Indigenous healthcare space as well. So on the next slide, I'll get you to go to just quickly on the capital structure for VFX, share price of 0.08 cent as of the 6th of Feb. Note yesterday it did tick up 12.5%. But more importantly is the alignment between management, the board, and shareholders. It's 36% held by management and the board, which gives great alignment for shareholder value between us and shareholders. Always a good thing. Moving on from the capital structure, I'll share with you briefly the exec team on the next slide. So you can have a great product and you can have great ideas, but anybody who's been in business long enough knows that you need the right people. You need a team who's battle-hardened. It's tough being in business. You face problems and you need someone who's been through it before. We've certainly done that. I've handpicked Michael and James. I'm lucky to have a committed, experienced team and in myself, both in international companies at Investec Bank and more recently at Credible in Australia, having co-founded it. I know exactly what it takes to build a business from scratch. We're in the healthcare space, the leading lender to doctors, and lent over $2 billion to doctors in a 4-year period, working very closely with medical device companies. So I've seen what it takes to grow medical device companies. It's a great space to be in, and Visionflex is very well placed to look after and deliver virtual care here in Australia and overseas. So what's driving virtual care? That's on the next slide, and I think that's really the interesting part here that we're looking at in our R&D meetings. What are we designing? What are we building? How can we solve some of these problems that healthcare are facing? So if you're looking at the healthcare sector, like any sector or mining, what's the market opportunity? What's driving it? Why would you look to invest? So telehealth alone is going up at a rate of about 20% compounding annual growth, estimated to be $500 billion by 2030. And there's some key drivers of those statistics around virtual care. You've got an aging population, a rise of chronic conditions. There's 7.8 billion of us on the planet, and there's not enough doctors and nurses to go around, and the governments don't have enough funds in order to provide sustainable care. So that, coupled with the advancement in technology and connectivity to underserved places like the sub-Sahara of Africa or the Kimberleys out here in Western Australia, has made a really perfect move to adaptation of virtual care. And the outlier here has been COVID. COVID has forced the world to stop and change and deliver things in a virtual environment because we physically couldn't move. And the results that government and healthcare payers have seen from virtual care has really started to drive the move for virtual care broadly right across all the modalities from hospital to aged care. On the next slide, very, very quickly, you're looking at 4 key drivers outside of those. A system, increased demand for services. We don't have enough doctors, we don't have enough nurses, an estimated shortage of 10 million around the world, and there's just not enough money to pay for that service sustainably. So increasingly, our conversations with government, with large corporates are around a cost-effective solution. How do you take a shortage of doctors and allow them to work from one location? How can they serve patients all over the world, all over the country, but be in one location? And we've been able to design, develop virtual products in hardware and software that's doing just that. So that's what Visionflex is. We design medical virtual platform to deliver, diagnose, treat patients virtually, just like you would in a hospital physically, same speed, same accuracy, albeit at a much more cost-effective and scalable solution. On the next page, Manny, the solution for Visionflex is really about 4 things. It's designing software and hardware that will solve these problems of an overstretched health system, the escalating costs, and it's allowing governments and health providers to deliver us more accessible, cost-effective solutions. It's actually improving outcomes. If you're sitting in a regional area and something goes wrong, trying to drive to Sydney, trying to get to a capital city, hospital admissions, you can't get the care that you need. And right now, using Visionflex, there's hospitals and governments that are connecting you to a specialist straight away using our video platform. So we're really proud about the equity and accessibility we can bring to people that are in underserved communities, particularly the Indigenous community. So the ecosystem is made up, on the next slide, of core hardware that we've built. We developed that hardware from 2014. We have a ProEX platform that does remote consultations, a very high-powered camera that allows you to look at wounds, take pictures and videos, and share those with other clinicians right around the world. And we quickly realized in video that Zoom's great for an ASX webinar, but not so great to deliver healthcare. I can't bring another camera into this meeting. I can't look at any heart rates. So we had to develop our own software system, which we did for 2 years, being problem solvers. And we have our own easy-to-use video conferencing platform called Vision. Now, Vision allows you to deliver medical services anywhere. I can turn my computer, my tablet, my phone into a roaming hospital, bring in multiple cameras, look at heart rates, check everything out I need to serve people instantly wherever we go. So these are the problems that governments are facing. These are the problems that corporates are facing, and Visionflex has been leading the way here in Australia and overseas with solutions. Next slide. So in Australia, we've got a lot of momentum with government in hospitals, in aged care, doing some great work right across the Kimberleys and the top end of Australia and closing the gap, working with giving care on country with Indigenous communities. And I wanted to touch lastly on two of the examples here that we have in Australia as I speak today. The first over in Western Australia on the next slide. So in Western Australia, we have 450 aged care sites run by the government. In the last 6 months alone, Visionflex has rolled out virtual healthcare to 150 of those sites. That is our mums and dads all from all over WA who are now getting timely, regular care. They're not going to hospital. We're getting early detection of diseases, which is fantastic, and it's delivering a much more cost-effective solution for the taxpayers and the government. So we're really, really excited to work with the WA government. We see a lot more potential in replicating that with other governments in Australia and all over the world. And on the next slide is an example in hospitals. We're a proud Northern Beaches business here in Sydney. I'm sitting here in the Northern Beaches of Sydney. Right now, as we speak, there's patients in Dubbo, in Wagga Wagga, all through Western New South Wales sitting in hospital. And a team of specialists in Sydney are working from their homes 24/7 using Visionflex's hardware system to look after them. They're literally getting access to the best specialists in instant time in hospitals. You rewind 3 years ago, and that was an ambulance trip for 6 hours to Sydney, and now they're getting care at home in their hospitals in a much more cost-effective way. So we're a passionate team. We're really thrilled with improving health outcomes and helping solve big problems in health. I'll go to some of the lastly business model for you. If I could just go through to the revenue slide, Manny. So our business has grown exponentially quarter on quarter. You can see there really strong hardware revenue from selling Visionflex into those government and large enterprise customers. We're only 14 months into launching software, and you can see there as our customers and new government contracts come online, we're really increasing the ARR of the recurring software, and that's our focus is software and recurring revenue as we continue to grow. Next slide for me, Manny. And again, please, just conscious of time. So wanting to get into some Q&A, if I had to leave you with anything, what are the 3 or 4 highlights of this business? Why virtual care? Why Visionflex? You've got a client base of government and health providers. You've got shifting demographic to virtual care, an increasing population, an aging population. You've got a revenue growth that's going quarter on quarter, a great team behind it, a great Australian product, a huge opportunity to expand overseas. So we're excited. We're grateful to be here today and looking forward to talking to people in the minutes ahead.
Great. Thank you, Josh. A couple of questions. I mean, the telehealth space has seen a number of players and offerings over the last few years. Can you talk to us a little bit about how Visionflex's product essentially differs from perhaps some of those other offerings? What makes Visionflex's product so particularly strong, so good versus some of those other offerings?
I'll give Apple as an example. It's that combination of hardware and software in a closed ecosystem. You've got Microsoft on one side and Apple on the other. In the healthcare space for us, there's a video conferencing platform in telehealth, but it can't perform the level of medical examinations that Visionflex can. Things like bringing in a second camera, checking a heart rate, looking at these vital examination tools we need to look after somebody. They just can't do that on their platform. And on the hardware side, nobody's being able to integrate other third-party devices like Visionflex has. And, that's a credit to our R&D team and engineers who have been at this for, 8 years now.
Okay. I mean, you've talked a little bit about the revenue, and you've certainly been doing very well on that front. But looking forward, in addition to the obvious industries such as primary healthcare, aged care, home care, what are perhaps some of the other channels, the other industries that could provide that are not as obvious, that could provide some additional growth for the company?
Yeah, I mean, you've got 2 stories. We run a domestic business here in Australia, primarily on healthcare, but we have significant business in the resource sector, both working with Exxon and Shell, FQM Minerals. Now, they have an extraordinarily challenging environment overseas to have a health and wellbeing program in challenging offshore rigs. we've been able to make some strong momentum in a pipeline with the resource sector. We also work in the correctional facilities with New South Wales Justice Health. More importantly for us, we're really excited about overseas. We've generated $1 million in revenue so far with little effort and focus. And myself and the team are very much focused on new agency partnerships for software and hardware overseas, because the product is an Australian product. Healthcare knows no limitations by boundaries, and this is a global problem, and we have a global solution. So we see extraordinary growth for us in the years ahead.
Right. And one last question before you go. Looking forward, what can investors and shareholders look forward to in, let's say, the next 6 months? What's the sort of news flow? What are some of the potentially, larger or more material announcements that we should be looking for?
Look, I haven't been in the public game more than a couple of years, but I know not to give too much away around material announcements. But you should expect that we'll continue to expand in the areas that we've announced. And looking at the momentum we have, you should expect that should expand at the rate it has or above. And you should expect some announcements in some of those other sectors that I might have touched on. All
right, Josh, that was great. Thank you for your time today, and hopefully we'll see you back soon with some with an update on progress. Have a great weekend. We'll see you soon.
Welcome back anytime. Thank you.